The COVID-19 pandemic is not over. Worldwide, it has caused more than 20 million deaths, and the death toll continues to rise. Hundreds of millions of people have been infected, as virtually every country's government has embraced the murderous let-it-rip policies. According to official figures in Australia, there have been almost 10.5 million cases detected and nearly 16,000 deaths. In November, studies revealed that 2/3 of the population have been infected. This includes nearly 70% of all children. For those aged 1 to 4, all of whom are unvaccinated, 79% had indications of infection. Compare today's figures to 1 year ago. On November 30th, 2021, there had been just 27,904 cases in the entire country and 2,000 deaths. This means infections have increased nearly 400-fold. The speed of the spread is staggering. Australia has reached and even exceeded infection levels per capita of other countries in just 10 months. Every day, the pandemic is downplayed or mentioned in the past tense. There is an attempt to condition the population into thinking there is no danger. This is a lie. Omicron was never a milder variant.
We were actually working in COVID during lockdown, and I was really scared working on a COVID ward.
The Premier said that we were coping in the midst of the COVID pandemic last year. He lied.
He's definitely just let it rip, and it's more for economic benefit rather than what's happening in the hospitals. Because during the Omicron wave, we were still smashed as well.
Yeah.
But they were saying they didn't want to go back to lockdowns again.
COVID cannot be lived with. It is killing people and causing thousands more to suffer from long COVID. New variants of the virus are sparking new waves, an entirely predictable and preventable situation. Leading health experts warned what the ending of all restrictions would mean.
What's happening now is absolutely unprecedented. And when you look at the known risks in terms of death, acute disease, and longer-term disease, and the unknown longer-term risks of an illness that replicates in pretty much all of the body tissues, if you keep grounding yourself in that reality, you just have to pinch yourself because you go, well, what's happening is crazy. So we are now infecting ourselves and, more critically, our children repeatedly with this virus that is rapidly mutating and changing its form with no firm knowledge of the long-term consequences, which we can't have because we haven't had it for the long term.
For raising these warnings, health experts like Dr. Berger have been censured. The question must be asked, who is responsible for the disaster now unfolding? The entire parliamentary establishment is responsible, including Scott Morrison's coalition government. However, the essential role has been played by the trade unions and Labor Party. They have worked hand in glove to remove all restrictions and let the virus rip. Since coming to power, the federal Labor government of Anthony Albanese did what Scott Morrison could not. In less than 6 months, Albanese has removed every basic safety measure. Here is a timeline of events. In June, mask mandates were removed for airport terminals. The Victorian Labor government removed 3-dose vaccine mandates in education, food distribution and processing. On July 8th, Labor Health Minister Mark Butler said Australia had moved beyond coordinated public health measures, saying, quote, "The message is, take responsibility, make your own choice," end quote. On August 31st, after Australia's deadliest month of the pandemic, the anti-constitutional National Cabinet met and reduced mandatory isolation from 7 to 5 days and removed mask requirements on domestic flights. Albanese ended pandemic leave payments on September 30th. He also ended free rapid antigen tests for pensioners and welfare recipients. In September, the National Cabinet ended daily reporting of COVID statistics and removed mask requirements on international flights. In October, Labor then scrapped all COVID-positive isolation requirements. In turn, New South Wales and Victoria dropped the requirement to report positive rats. This is a declaration of war against public health, workers, people with a disability, and the immunocompromised. While declaring it is down to individual responsibility, the Labor government has willfully withheld accurate and truthful information. One could easily describe the situation as madness. In fact, this is how Albanese himself described such a scenario in Parliament before becoming Prime Minister.
I'll tell you what madness is. Madness is saying, let this disease rip. Let people die. Let whole economies be shut down. Let's stop us being able to return to our way of life. That is what is madness.
The homicidal reopening policies are driven by the demands of big business, of which the Labor Party is the closest ally. In their eyes, the economy must be reopened and the population must forget the virus exists so profits can flow. The deaths of tens of thousands and the disabling of thousands more must not get in the way of filling the coffers of the rich. Operating as industrial policemen, the unions have spearheaded the reopening by suppressing workers' opposition. In both New South Wales and Victoria, the teacher unions played the key role in forcing educators back into unsafe classrooms. This had nothing to do with concern for children's education or mental health, but was to ensure parents could be driven back to virus-ridden workplaces and factories. The health unions did the same. In December 2021, they worked out a protocol to force COVID-infected health workers back to work, setting a precedent for all other industries. In August, prior to the decision of the National Cabinet, Health Services Union National President Gerard Hayes demanded the scrapping of mandatory isolation. Not a single union across any workplace or industry has organised resistance to the reopening drive. All have enforced the return to work and now peddle the lie that the pandemic is over. But workers are willing to fight. Across the country, health workers, educators, rail, logistics, industrial and other workers have launched or voted overwhelmingly in favour for strike action against their intolerable conditions. They join their working class brothers and sisters internationally who are in a common struggle not only against the bosses but capitalism and its representatives. This includes the social democratic parties, the various Labor parties and the unions themselves. For educators and health workers to take a step forward in protecting themselves, their families, the population from infection and death, they must break with these organisations.
Over the last 2 years with COVID, we just dealt with it, right? So we just toughed it out. But it's been 2 years, and I think we've been through enough that I think it's about time we speak up.
We did our absolute best. We want better ratios to help patients and to help the fellow nursing staff.
Workers must take control of the response to the pandemic out of the hands of the pro-business governments and unions and into their own. New organs of struggle must be built in every school, hospital and community. These independent committees of rank-and-file workers must meet to democratically discuss and formulate their own demands. The mantra that everything must be sacrificed for the wealth of a few must be replaced with the demand, lives before profits.